Hi, I'm Kristi Frank, and welcome to America's Leading Doctors. This is the show that brings you the country's best and brightest professionals, as well as information you need to live a happy, healthy, and wealthy life. Joining us today is our special guest, Dr. Stuart Waite, who is a hospital dentist, and he stands for health and wellness for all. Welcome to the show, Doctor.
Thank you, Kristi. It's good to be here.
So I'm so glad to have you here. So, Dr. Stuart, tell us a little about how you got into medicine and how it all started.
Well, I guess I'd have to credit my father and brother who went before me and got into really oral surgery, and I followed suit and did dentistry, but with a special niche of working in a hospital setting.
Right, and there's something special about your practice. Let's talk about everything that you get to do.
Well, it's a unique practice. We're based in a hospital. Most people think of going down the street to see their dentist, and we provide those types of services in our professional office building, but we're adjacent to the hospital, and so we take care of all the special needs that this large metropolitan hospital, St. John's Mercy, has in St. Louis, Missouri. We run a residency program for the recently graduated dentist so that they can become more familiar in how to treat people with special needs, whether mental or physical needs that limit them from seeing a dentist in an outpatient setting. They would come to see us.
So would you say you've got not only the teaching facility, but are you more of an on-call dentist? Would you actually go into the hospital and treat patients there?
Yes, we would. We're on call 24/7 for the 1,000 patients that are admitted to our hospital, the emergency room service, and for those patients that come to us on a regular basis, some of them need to go into the operating room to be asleep while all of their care is completed in that one episode.
Wow. So you get it all finished in one time. That's actually very beneficial.
It can be.
So you have amazing customers that like to say how incredible your work has been. Tell me about one of your favorite customers.
Well, I think I would think of the many of them that have said, "Gosh, I wish I would have done this sooner. It's nice to have it all over with, and I love what I can now do, and I love my new smile." I would think of one lady in particular who was suffering from a condition called agoraphobia. She never left her house.
Wow.
And literally she hadn't been out of her house for 10 years. In this circumstance, she developed an infection in her leg that ended up having her hospitalized. And when her medical doctors saw her and the condition of her mouth, they knew they needed to involve us as well. So we evaluate her, decide, gosh, there's almost nothing that can be done at this point except take a good number of her teeth out. And it was the connection of the bacteria from the mouth that was causing in part the infection in her leg. And once that infection was cleaned up, her leg problems and the cellulitis improved, and she also got treatment for her mental health issues, and she was just so appreciative and really a part of a life-changing event.
Wow. Hasn't it been more prevalent in the media that bacteria in the mouth is actually related to heart disease, or that there's something?
Yeah, that's what's really exciting right now is that medical and dental communities for years have isolated the mouth. And what a funny thing to do, to just say this part of our body has nothing to do with the rest of our body.
It's true.
So now we're starting to come around to the idea that there is some connection. We don't understand it entirely. It's not always a cause and effect. But we're starting to see glimpses, Kristi, of how the two are connected. And that's what's really exciting. That's what we want to help our patients understand and know more about, is that while we don't have all the answers, we know that by having better oral health, you can have better systemic health.
Okay, so as the expert dentist, tell us maybe one tip we can take away. Regular dental checkups, brushing morning and night. What's your best advice?
Well, let me first start by saying, imagine if you know that having high blood pressure or having heart disease is going to lead to a possible stroke or a possible heart attack, and you do nothing about it to change your lifestyle or your diet or whatever, you're kind of, you're shocked when you have a heart attack, but you shouldn't be.
Right.
You didn't take the steps to improve your health. And oftentimes patients come into the office and we finish their examination. They're kind of surprised. Well, gee, nothing hurts. How can I have these problems that you're telling me about? It's the same correlation between high blood pressure and stroke, between dental disease, periodontal disease, and mouth care problems. So the one thing you can certainly do is take better care of your mouth. Brushing, flossing, yeah, you've heard all of that before. But making sure that your gums don't bleed, that you don't have periodontal disease, that you don't have infections that are just waiting for the opportunity to spread infections to the rest of your body. That's what we're trying to help people be educated about and know where to go for the right answers instead of just getting everything on the internet.
That's great. And doing it in a friendly, relaxed, comfortable, hands-on way.
Thanks. That's what our team is focused on, is trying to connect with people, trying to communicate in a way that we really just are educators. We're trying to teach not only the dentists that we work with as residents and mentor them, but we're also trying to work with our patients, helping them make decisions that are truly informed and not either postponing things because of fear of cost or fear of pain or just not knowing how to do it. We want to try to eliminate those barriers to care and treat people where they are with the information that they need.
It's so evident, and thank you so much for sharing your information. So where can we go to find out more and maybe tips on healthcare?
Well, I'd be glad to just mention my website, and of course we have a phone, so you can always call, but stjohnsdental.com is our website, and you can find out information about our practice and our location and hours, all of those things, and some links to some valuable information that we think you'd need.
I love it. Thank you so much for being here today and
Kristi.
reminding of us some of those things that we do need to hear again and remember, and coming from you, it makes it very pleasurable.
Good. Well, thank you very much.
Thank you so much. And thank you for being here with us today. We'll see you again next time on America's Leading Doctors.